Well, you've just had your rhinoplasty, and the most important thing after a rhinoplasty from the patient perspective is to get the nose clean. Your nose will bleed the first day into the second day following rhinoplasty. There will be a drip dressing or a mustache dressing that's underneath your nose to collect any drainage. That will be changed many times in the first 24 hours, possibly up to 10 to 12 times. In the first 24 hours, we want you to clean it each time you change the dressing. The cleaning procedure is very simple. We use a Q-tip. The distance of the cotton head of the Q-tip is how far you're going inside each nostril. The Q-tip will be placed in hydrogen peroxide and then placed inside of each nostril and rolled around. A fresh Q-tip will then be placed in peroxide and cleaning any of the black stitches you see either underneath the tip of the nose or on each nostril. That will then be followed up with a Q-tip to apply the antibiotic ointment. Following the first 24 hours, and once the bleeding has come down to a point that you no longer need the dressing, we will default to 4 to 6 times a day cleaning. The cleaning regimen is exactly the same. How hard to clean the nose? The first thing I usually tell patients is I'm not worried about you disturbing the end result of your nose because of the cleaning regimen. I've never seen it happen. The next thing I would tell you is it's very hard to express how firmly to clean the nose. So whatever each patient thinks is sufficient pressure to get the nose squeaky clean by the end of the week, that's what I want you to start out with. At the halfway point of the week, you will look inside your nose along the suture line, and if it is crusty, we will have you increase your pressure. It means you're being too gentle. Assuming that you come in with a squeaky clean nose, your post-op experience is virtually painless. It also leads to way better healing of the incisions. If you come in crusty, the crusting needs to be removed, and the incisions in turn get disturbed in their healing process. So it is very important to keep your nose and get your nose clean by the end of the week.